Nicola Sturgeon was shamed by Sean Fletcher on Good Morning Britain as she outlined her hopes for independence and for Scotland to rejoin the European Union. As the Scottish elections draw closer, Sean Fletcher quizzed the First Minister of Scotland about her plans for a second independence referendum. Nicola Sturgeon outlined her hopes the country could rejoin the EU, but the Good Morning Britain host was keen to point out there were downfalls of rejoining Brussels. As Sturgeon detailed the benefits of Scotland joining the EU and the single market, Fletcher pointed out it wouldn't have helped with vaccination against COVID-19. Independence is actually about expanding our horizons and not narrowing them, Sturgeon argued. Fletcher hit back. It's worth pointing out that if an independent Scotland was in Europe, you wouldn't have 2.8 million people vaccinated, would you? I think that is utterly nonsense, Sturgeon replied, but Fletcher persisted. Look at Europe. They're way behind in their vaccinated program. Sturgeon argued. The UK was still in the transition period when it procured the vaccine, and that didn't prevent it procuring the vaccine on a four-nations basis with England, Wales, Northern Ireland and Scotland. The way we procure the flu vaccine every year, that was done. Nothing would have prevented that happening had we still been in the European Union. Of course, the delivery of the vaccination program in Scotland is down to the sterling efforts and fantastic work of the NHS Scotland vaccinators and teams across the country. They have my deep and everlasting appreciation for the fantastic work they're doing, and the procurement of the UK government getting those vaccines. Fleck the swiped. Earlier in the interview, Sturgeon explained she supports a public inquiry into the handling of the pandemic in the UK. We're still learning about this virus every single day, she said. We try to adapt our response depending on that learning. If I can come specifically to care homes, I think everybody in a leadership position should be very reflective of the things we might have done differently if we had known everything that we know now about the virus. It's important we learn lessons. We've already had experts here in Scotland do an initial study, and before I say this, one death is one too many and we have a lot to learn. But they have found that while they can't rule out any impact, there is no statistically significant associations between hospital discharges and care home outbreaks. They say the much bigger driver of care home outbreaks was the size of the care home. Sturgeon continued. Now we need to do a lot more. That's why I think I'm the only leader in the UK four nations to give an unequivocal commitment to a public inquiry into the handling of this, including the handling of what happened in care homes, and to get that inquiry underway. I hope before the end of this year. When Garraway pressed Sturgeon about the care home crisis, she explained, we're still learning about this virus every single day and we try to adapt our response depending on that learning. Everybody in a leadership position should be reflective of things they might have done differently. One death is too many and we've got lots of lessons to learn. I think I'm still the only leader in all of the four UK nations to give an unequivocal commitment to a public inquiry of our handle of this. I hope before the end of this year.